All right, Jason, on today's show, we're interviewing Dr. Sarah Knife Chief.
That's a name.
She's a doctor right here in Tulsa, Oklahoma. Her name is Dr. Sarah Knife Chief, and we're interviewing her about how the COVID-19 deaths are being dramatically inflated. We're also asking her about why Dr. Fauci is Mr. Conflict of Interest and why proven treatments are being blocked. Folks, listen, if what Dr. Sarah Knife Chief is saying to you is true, that means the media has been lying to you. Think about that. If what Dr. Sarah Knife Chief is saying, if what she's saying is true, that means Dr. Fauci, Dr. Birx, Dr. Redfield have been lying to you. And on today's show, again, she talks about how the COVID-19 deaths are being dramatically inflated, why Dr. Fauci is Mr. Conflict of Interest. And she explains why the proven treatments for COVID-19 that have actually been shown to work are being blocked. Why would you want to block people, Jason, from the treatments that actually work to treat people of COVID-19?
I don't know. It seems a little fishy. Why would you want to do that?
Why would you want to keep people from not becoming healthy after they come down with a disease?
Yeah, you're a doctor. You want to make people well, right?
Perhaps because you want the vaccine to be the only solution?
Could be.
Ladies and gentlemen, grab a pen and a pad as we enter into the dojo of Mojo with Sarah Knife Chief right here on today's edition of the Thrive Time Show on your radio and podcast download.
3, 2, 1, boom! You are now entering the dojo of Mojo and the Thrive Time Show.
Thrive Time Show on the microphone. What is this? Top of the iTunes charts in the category of business. Drilling down on business topics like we are a dentist. Providing you with mentorship like you are an apprentice. And we go so fast that you might get motion sickness. Grab a pen and pad to the lab. Let's get in this. It's time to bear some fruit like some Florida oranges. 3, 2, 1. Here come the business ninjas.
Yes, and yes, Thrive Nation, you are in for a very special occasion because on today's show, we're interviewing Dr. Sarah Knife Chief. Dr. Sarah Knife Chief, welcome on to the Thrive Time Show. How are you?
I am doing fine. Thank you for asking.
Now, your last name is not a common last name. I mean, I've met a lot of people, a lot of Smiths, a lot of Thomases, a lot of Thompsons, a lot of, but I haven't met any Knife Chiefs. So you got to tell us, what's the story behind your last name?
And if you do meet a knife chief, they're definitely related.
Oh, really? Okay.
Our last name was actually the story behind it was that it was given to us because we were basically makers of knives. Our original name given was Man Chief. That was what we were known to each other. And as we became in contact with the settlers, we were famous for knife making. And I still have an uncle that makes specialized knives today. So we were given that name, Knife Chief, and it's carried down, obviously, generations.
So you are from a Native American ancestry. Is that correct?
Absolutely. Yes, absolutely.
And what tribe?
I'm sorry, what was the question?
What tribe?
So my father is full-blood Pawnee Indian.
Okay.
So the Pawnees originated out of Nebraska, Kansas, and even up to the southern border of South Dakota, and actually expanded down into Mexico.
Okay. So
we covered a lot of ground.
I don't know if it's because what you're saying on radio interviews and in different media appearances is cutting to the truth of the matter so quickly, or if it's the fact that your name is so memorable. But people keep telling me you've got to have this lady on your show, and you got to ask her some questions. So I've got a list of questions that some of our listeners wanted me to ask you, and I'm just going to go through them one by one, and hopefully I do a good job asking because I know you're going to do a great job answering. So here we go. According to the Center for Disease Control, in 2017 and 2018, as reported by CNN, 80,000 people died from the common flu. However, in 2020, there seems to be some confusion about how many people have died from COVID-19. Why is there such confusion about who's dying from COVID, who's dying with COVID? Walk us through this for people out there that don't have a medical background.
I think the answer, sadly, as everyone has discussed, is it really has seemed to have turned into a political fight instead of really leaving it to the doctor-patient relationship. And honestly, I think this transition began back when basically the things like the managed care plans, Medicare kind of took over the doctor's practice, and we became providers instead of physicians taking care of patients. And so because of that, they kind of control the narrative on and how doctors practice medicine, what we are allowed to say and not say, what we can and can't do. And they're using that information basically to now pass this narrative that COVID-19 is this huge pandemic that ultimately will only be cured by vaccinations, which we know, just looking at the money trail, leads back to things like Anthony Fauci and Bill Gates as far as who's going to make the most money off developing a vaccination for COVID-19. So because of that, we have to suppress the number of flu deaths and raise the number of the COVID-19 deaths to make our narrative the way we need it to be. And it's really sad that it seems to me, and it's very frustrating to me as a physician who really cares about the doctor-patient relationship and really wants to help people get better, that we have to basically, if we speak up against anything, we're the ones that are vindicated, because we have to fall in line and we have to follow whatever big company controls us as far as the narrative. And right now the narrative is COVID-19, obviously.
So you're saying...
But that's true. If you look at the flu numbers this year, they are way low. Even the lowest flu numbers in the history are kind of range around 25,000, 30,000 a year. And this year it's not even close to that number. So every death that seems to be occurring, they want to label it as COVID for the ultimate goal of making money off of that. And also hospital systems make money, as we've heard and know, off of COVID. If somebody's diagnosed with COVID-19, they make a certain amount of money off of that. If that person then gets hospitalized and ends up on a ventilator, the hospital systems get reimbursed for that as well. So the incentive for the hospitals are to diagnose as many people as possible with COVID-19. Well, the thing about coronaviruses is they're all over all the time. The common cold is a coronavirus. And so the tests are not accurate. They're not specific. So we're getting false positives. But again, everything seems to be pushing a certain narrative. And I'm not one to say I would hope the medical community in general is out for the best patient care. You know, we all took that same oath to do no harm. So I don't think intentionally people are wanting to hurt anybody. But it seems to be there's so much censorship of the medical community these days if it doesn't fit that narrative that everybody needs to have COVID. So I think it's pretty sad what's occurring, in my opinion.
So you're saying that you now are many people in the medical industry are being forced to act as care providers rather than physicians. Am I getting that correct?
Yeah. So if you work for a big hospital system, you're as a physician meant to meet certain guidelines. You have to see a certain number of patients. They push this thing called RVUs, which basically are box checkers. If you meet these certain criteria for these certain patients in the hospital, and the practice will get reimbursed a certain amount of money. And so that's why it's turned into, instead of me being able to take my time with each patient, it's about how many patients can you get through the system, because that means more money coming into the pocket. How many patients can you, for example, get on prescription medications? How many, if you have, say, as a surgeon, specific complications that are sometimes unavoidable, for example, postoperative infections after a surgical procedure, or say somebody gets a blood clot after a surgical procedure and they come back to the hospital, then the hospital doesn't get reimbursed for that procedure. And so there's a lot of things mechanistically that we have to do as physicians now, instead of just really focusing on patient care and taking care of the patients. And so we basically are just looked at by the people that we work for as a means to provide money back into their pockets instead of, hey, are we really being able to sit down and converse with patients and really take good care of them? And so that's, for me, why I got out of that kind of system and went into a private practice type of system, because I really wanted to take control of how I want to take care of patients and not do what I have to do to make whomever I work for money, if that makes sense.
Yeah, no, this is you're providing a lot of clarity, and I'm a simple man, so I like that you're explaining it in a way that I'm grasping. Now, Dr. Knife Chief, Dr. and Senator Rand Paul, he recently stated if you look at under age 18 patients, the mortality rate from COVID-19 is about 1 in a million. If you look at age 18 to 45, the mortality rate is about 10 in 100,000. Above that, it increases, but interestingly, it is still pretty small. In the vast majority, even people up to 65 years of age, it may well be between 95 and 99%. They have a very mild case of this. So I'm not saying it's a benign disease, because people do get sick and die from this, but your chances are good. We shouldn't live in fear forever. We should take normal precautions. We should assess the risks. People who are older should take precautions, but we shouldn't, cover the faces of our children and say, you're going to have to live your whole life with your mask on. We shouldn't do that, and the government definitely shouldn't mandate it. Is Dr. Senator Rand Paul correct, or has he lost his mind?
No, Dr. Rand Paul is absolutely correct in that regard. There's been several studies that have demonstrated that children just do not transmit this virus like adults do. They do not transmit it between each other. They do not transmit it to adults up to a certain age, like you discussed. Past that certain age, it gets a little bit higher, but even then, it's extremely rare. So I think it's really sad to see children walking around in face masks everywhere and at school. And you see these pictures of children having to be separate from each other. And part of our mental health and well-being is we're social individuals. We need to interact with people. We need to touch people. We need to transmit constantly bacteria and viruses between people. That keeps our immune system up. And we need our kids to be socialized with each other to develop a normal brain pattern as we get older, as far as from a mental health standpoint. So I think it's really a shame when we see this happening to our children. We don't do any of these things during the flu season at all. And children are at the greatest risk, and the elderly, of dying from the flu. So historically speaking, we have not taken any of these precautions with the flu virus. So why are we doing this with our children now? I think it's really sad to see, honestly. But yes, I agree 100% with Dr. Rand Paul's assessment on that regard.
That is just mind-blowing.
Go ahead, sir.
It's mind-blowing.
I see several people now driving in their car with masks on. I see people not wash their hands when they leave the bathroom. I see people wearing the same masks over and over and over again. I see people touching the masks constantly, touching everything else, bringing the mask down and up and down and up. And none of those things are healthy in an environment where you have even flu or any other virus that is going through. And the other falsehood is that viruses don't just disappear and go away. So for them to say, we need to wait till this virus goes away, or we get a vaccine to treat the virus before we're going to open up, is really counterintuitive to how viruses work. And number two, the flu vaccine in 2017, 2018, I believe, was only 17% effective. So how does that correlate with the narrative now that we're getting that we need to do this until the virus goes away or till we get a vaccine? Because none of those are 100% effective either. You know what
you're doing right now? You're blowing my mind. I'm gonna have to duct tape my brain back together. I'm going to continue going down these questions here. Now, the deadliness of the coronavirus. Dr. Knife Chief, Stanford's Dr. Scott Atlas, the medical doctor, he recently said during a White House press conference, the deadliness of the coronavirus is less than that of the seasonal flu for children. He said this while speaking directly to the President of the United States while wearing a purple tie after being introduced as the newest member of the White House Coronavirus Task Force. Do you believe that the deadliness of the coronavirus is less than that of the seasonal flu for children, as Dr. Atlas has stated?
Absolutely. Absolutely. 100%.
Now, Dr. Knife Chief, hydroxychloroquine, this thing has been an FDA-approved drug for decades. My understanding is that the number of deaths from hydroxychloroquine worldwide is almost laughably low.
Correct.
It's like something like less than, if I'm exaggerating, let me know. But it's something like less than 100 deaths ever in the history of this drug that's been around for decades have been caused by hydroxychloroquine. Is that correct?
That's correct. It's extremely low. And we have to think about, historically speaking, who is put on hydroxychloroquine. People who have chronic autoimmune disorders like lupus and rheumatoid arthritis, even children with juvenile rheumatoid arthritis. And so these people are not healthy in general. They don't have a great immune system. There's even been studies that show that people who take hydroxychloroquine on a regular basis, and I'm talking about studies prior to coronavirus, before the narrative has been skewed, has demonstrated that people that take long-term hydroxychloroquine have less heart attacks. They have lower kidney dysfunction. They have lower cholesterol rates. And so the narrative that was being pushed is that it is so deadly and it causes these heart issues really hasn't been proven scientifically prior to the advent of coronavirus. Previous to coronavirus, it was actually shown to have some protectant for the heart. So the narrative is completely flipped upside down, and where it started was the Lancet study that was released. And come to find out, that study was completely falsified. They were using significantly high levels of hydroxychloroquine.
Wait a second. You just said, I just want to make sure I'm getting this. You're saying that the Lancet study that everybody referred to, the one that everybody said, hey, we shouldn't be taking this because the Lancet study came out. You're saying that study was completely false?
Absolutely. And they actually retracted that study 2 weeks after it was released, which is really never, and I hate to say never because it may have happened in the past, I just don't know of it particularly, but it's never really happened to studies. So 2 weeks after that study was released, it was retracted. And second part about that study is they used 2,400 milligrams of hydroxychloroquine in patients who were very, very sick. And the normal dose of hydroxychloroquine on a regular basis is 400 milligrams a day. So compare that to 2,400 milligrams. You're overdosing these patients who are already sick. The use of hydroxychloroquine, and especially there was a physician out of New York, Dr. Zelenko, who has a Zelenko protocol and has released his study on his patients, and several other doctors anecdotally throughout the United States. Hydroxychloroquine, Z-Pak, and zinc are very effective in patients who are early on in their disease, so before they get to the point where they're ventilated. By the time they're ventilated, of course, that has not been shown to be effective, but really nothing has. They try and push that remdesivir, which they were going to charge $3,100 per infusion on these patients, and there were more side effects to that treatment and no change in the death rate in that patient population, but the narrative is to push that medication versus something that has been around for decades, has been proven to be very safe, and is shown to be effective in high-risk patients who become symptomatic early on in their COVID-19 disease. Now for low-risk patients, because majority of patients, young, healthy children, they're going to either be asymptomatic or they're going to have very mild symptoms and they're going to get over it. You don't necessarily have to use that protocol. There are other medications that have been shown to be effective in that, in those cases, or even just not doing anything, and those patients will get over it. But as far as hydroxychloroquine specifically, it was never touted to be a miracle cure that's going to heal people when they are ventilated and they are at the end of their life with COVID-19 sick in the hospital. You have to, and that goes back to the doctor-patient relationship. As a doctor, you have to tailor your treatment specific to each patient. It's not going to be one treatment is good for everybody. And there's no way corporations and management companies can understand that because all they see are numbers. They don't see specific patients coming in with different underlying issues that we as physicians should be able to see and tailor our medicine to help different patients on an individual level.
So so far, I want to make sure I get this. You're saying that the deaths are being inflated by misclassification. That the treatments that actually work are being blocked. Do you believe we should be trusting Dr. Scott Atlas, the medical doctor, the leading medical doctor from Stanford, or Dr. Anthony Fauci?
As far as if we look at just financial discrepancies, Dr. Fauci has a lot of financial interest in the NIH and in patents on coronavirus and testing and ultimately the vaccine. And Dr. Scott Atlas doesn't have those financial interests. So if we're looking strictly for the potential for fraud from that aspect, then I would say we need to look at Dr. Scott Atlas over Dr. Fauci, who hasn't treated a patient personally in many, many, many decades. And just again, anytime it comes into something that's kind of the water is muddy, I always follow the financial trail and who is going to benefit financially from it. And you hate to think that the medical community has gotten to that point, but it seems like it has, unfortunately.
Dr.
So,
Knife Chief, are you pretty committed to being a doctor? Are you looking for a fallback career?
Absolutely. No.
Here's the deal. I'll make you an offer right now. If this whole doctor thing, if you kind of lose your passion and you want to become a hairstylist at one of my businesses, the elephant in the room, let me tell you, the pay's lower. The skill level might be about as difficult, but I'll tell you something. This is something that's crazy. We have a lot of really good employees, but some people in the past have lied about their tips. And I've worked with a lot of doctors one-on-one over the years because I do consulting and helping businesses grow. And I actually know of some doctors that I had to fire as clients because they were lying. They would lie.
Absolutely.
And so I'll tell you how I found out they're lying. Because a buddy of mine is getting a lot of, he's getting big, he's getting bulky, and he's kind of older than me. He's in his mid-40s. And I'm going, I said to him, hey, are you on the sauce? Are you taking steroids? He goes, oh, yeah, there's a doc over here around the way. This guy will write anybody a prescription for that stuff. And I said, really?
Absolutely.
He goes, yeah. Actually, this guy used to be on drugs, too. He had a drug problem. And I go, isn't that the same doctor that used to write you those prescription things? He goes, yeah, he's kind of a, free medicine cabinet kind of guy. And I'm going, are you kidding me? So I know there's corruption within the hair industry. I know there's corruption within every industry, professional sports.
Absolutely. I mean,
nobody's
if you just look at the opioid epidemic, you'll see a lot of physicians opened up what they call pill mills, and they were using their medical license to write enormous amounts of opioid prescriptions for cash money in return to patients. And some doctors were even using part of that stash to treat themselves and also making money off of it, off the community. And that was a big deal. And so, we aren't protected from fraud and corruption. And, we are human beings and we make mistakes. And when you dangle that big nugget in front of some people's eyes, they're going to grasp that nugget. Me personally, that's why I work. Actually, we opened this medical spa in Tulsa. I work for free because it's my dad's medical spa, and we're a brand new company, so I don't even make a penny working here. And number two, I travel around to different Native reservations providing free medical care. I've treated COVID-positive patients with the protocol that we just talked about successfully. Not a ton to make a study, but I have done that, and I provide free care. So, me personally, just talking about me. I'm not interested in the financial aspects of it. I'm truly in it to help patients. And I think majority of physicians are. And so it's really disheartening to me to see some of these physicians out in social media getting taken down left and right, that cancel culture, because they choose to stand up for what they believe, and looking at the same data as these, say, other physicians who come to a different conclusion. Is any one more right versus the other? Are we both in it to try and help patients? Why are we being vilified, censored, shut down, cancel cultured for speaking up on what we believe our truth is, but the other side isn't, just because it matches a narrative that needs to happen today? I think it's really sad commentary.
Well, what I'm going to do now is I'm going to move into the rapid fire round, okay? Because I'm going to go just 90 miles an hour. I'm throwing at questions at you super fast. Here we go. Dr. Richard Bartlett was a top medical advisor to Governor Rick Perry of Texas for 7 consecutive years. He was on our show, on the Thrive Time Show, and he stated that for just $237, every COVID-19 patient that he's treated with a nebulizer and the FDA-approved Pulmicort/budesonide. So he's treating people for $237 with a nebulizer and FDA-approved asthma medication. He said none of them have died. You're correct. And the CPAC. He said none of them have died. Yes. Is that real? Is that true? Is that possible?
And that comes directly from his mouth. I would have to say that's his truth, and I would say it matches what COVID-19 does in the body is creates this inflammatory cytokine storm. So anything that's going to calm down that hyperinflammatory response is going to be beneficial. So if if the COVID-19 is attacking the ACE receptors, which is the receptor in the lungs, causing the cytokine hyperinflammatory storm, if you're going to inhale a steroid, you're going to stop or block or lessen that storm so that the viral load will be less, so your body's own immune system can then fight the virus. And the Z-Pack, in case you get a secondary pneumonia from that, prevents that. So yes, I've seen his particular work and what he said directly from his own mouth. I would have to believe that, and it would make sense just based on what the virus does in the body.
Now, my next hot question here for you is Dr. Andrew Kaufman from MIT, Duke Medical University of South Carolina. This is a graduate from MIT, Duke Medical University of South Carolina. He states that COVID-19 tests that are being done are producing false positive test results over half the time. He's saying that the COVID-19 tests that are currently being done, these antibody tests, are producing false positive tests over half the time. How is this possible, ma'am?
Well, a lot of the way our body fights this virus is actually through a T-cell immunity, so it's not necessarily producing an antibody, IgG, IgM antibody that these tests are testing for. So the test in and of itself is not reliable or accurate. And nobody the PCR tests don't look at T-cell immunity, which is the way our body fights viruses most of the time. So that's why the tests are inaccurate. Secondarily, there was a story that broke directly from the CDC in April, and nobody paid attention to it, nor did they really put it in the media much, that the initial tests that were released from the CDC to test for COVID-19, the reagents were already seeded with the COVID-19 virus, meaning the test already came positive. And so you were going to get a ton of false positives in the beginning. They did not realize that for a whole month. So not until May did they realize that the tests that they were sending out were already positive before they were even testing people. Of course they were going to come back positive.
This is an interesting story. The U.S. military came out and they said, "Hey guys, here's the deal, guys. Here's the problem. With these COVID-19 tests, we want to make you guys know. We want to update you that the tests. We told everybody that you guys had COVID-19. We want to let you know that you don't have COVID-19. So in air, the company TRICARE. This is on military.com. They had to tell 600,000 beneficiaries.
Yeah.
They said, "Hey, you guys have COVID-19," freaking people out.
Correct.
Then they had to come back and retract on July 22nd and say, oops. So, I mean, you're seeing this everywhere. Now, Dr. Dan Erickson, we just had him on the show, the famous doctor from Bakersfield, California, the entrepreneur and the doctor. He said that you have a 0.002% chance of dying from COVID-19 if you get it, which means for every 10,000 people, 2 of them would die from COVID-19.
Correct.
And he said,
and that number fluctuates, but it doesn't fluctuate too far.
And he says, does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate being putting people out of work? He said, I would love for he said, I would love to just ask you this question. He's just asking rhetorical questions for the people watching the press conference. Do you believe that lockdowns, shutdowns, and mask mandates should have been the response to COVID-19?
I think that we should have gone back to basic immunology, and if you're sick, you need to stay home and quarantine yourself. If you're healthy, no, but you need to wash your hands. You need to try and stay away from large crowds. Don't cough on people. Don't sneeze on people. In the beginning, it was just so rich that they were even saying, well, COVID-19 stays in the stool longer than it does in the lungs. So what about all these people using public restrooms, and COVID-19, penetrates the eyes. Well, the eyes are not an effective blocker of viral load. So why are we not requiring people to wear goggles, initially? Why are we putting people in masks when if we are sick, we're going to blow that virus into our eyes, which again cannot take the same viral load that our mouths can. So are we hyper-infecting ourselves if we're already sick and we're wearing masks? Wash your hands. Stay away from people. If you're sick, stay home. Please boost your immune system. Majority of the patients that died out of New York had a vitamin D3 level less than 20. And something like 67% of those had a vitamin D level less than 12. So why are we not talking about boosting our immune system, making sure our vitamin D levels are normal? Because that also helps with the flu when it comes around. Why are we not talking about the 33,000 people that die every day of heart disease? Why is that not a pandemic? Why is diabetes not a pandemic? So that just intuitively, it's just very odd to me. And I'm from the very beginning, I've been on radio shows just questioning the narrative. And no, I don't want people to die. I'm a doctor. I want people to live and be healthy. So why would I push something that I felt was dangerous to society?
Okay, I've got 3 final questions for you, coming in hot, coming in fast. Here we go. Many doctors, many doctors, experts, gurus have been telling me, hey, Clay, listen, if you wear a mask for a prolonged period of time, Clay, listen, if you wear a mask for a prolonged period of time, one, I mean, you might look better, but it's going to probably cause you to get sick, And I'm going, what? Right. And it all started because I had one of my employees that was saying, I'm feeling nauseous during the day.
Yes.
And then my wife and I went on an airplane because the President of the United States, his White House invited me to attend a press conference with about 100 other people there on deregulation. I was honored to go there. And we had to put on the mask, and it's like, people on the plane are talking about feeling sick, and so my employees are feeling sick. And as an employer, you don't want your employees to be sick. So I called a couple doctors, and they said, if you force people to wear a mask, what happens is they have less oxygen, which it pulls their oxygen levels below the 19.5% oxygen level that OSHA requires on their website. So you're actually making people suffer from oxygen deprivation. Furthermore, they're breathing in the same funk all day, which makes them sick. Is that correct? Is that what happens when you wear a mask?
That's correct. That's correct, especially when you wear the same mask all day long, every day. And, people say, well, doctors and nurses do it. Well, before COVID-19, nurses did not walk around in the hospital in masks all day long. Doctors did not walk around in the hospital in masks all day long. Me, in the surgical suite, we're in a clean, sterile, cold environment that's super oxygenated. We're not walking around outside in the humidity, causing this fluid to collect on our masks. Now we're getting these virus particles to attach to this fluid, and then we are rebreathing that fluid.
Sick.
And also we're getting stories coming out now where people are getting bacterial pneumonia.
Gross.
People are getting periodontal gum disease. They're getting thrush. They're getting Legionnaire's disease. Wearing a mask is not benign. It's not something to take lightly. And people say, well, I have asthma, I have this, I can wear a mask. But you don't really think about the long-term complications that can come from, that sort of thing. And even if we're chronically depriving ourselves of oxygen, even if it's just mild, that affects our kidneys, which is a highly metabolic organ. And so there's no telling long-term what the damage will be from chronic mask wearing, which, again, the data before COVID-19 hit from the flu, even all the way back to the 1918 flu, studies have shown that masks do not prevent transmission of the virus. It just doesn't make it an effective treatment. So you would have to have so many layers on that mask, you would basically suffocate.
What's your religious view?
Oh, as far as in what regards?
I mean, are you like
Am I a Christian?
Are you a Judeo-Christian, or are you atheist, or are you agnostic? Where do you fall in the spectrum? What's your? And if you don't want to ask, it's fine.
I'm a Christian. I also practice Native American spirituality, but I'm a Christian.
Okay, well, I'm asking this because I've been praying. I have been praying.
Absolutely. Yep.
And one thing I've been praying for is I was praying that Dr. Scott. I mean, I specifically was praying this specific prayer. I said, "Dear Jesus, please connect Dr. Scott Atlas from Stanford. Connect him to President Trump, and connect Governor Noem to President Trump, and connect Dr. Dan Erickson to President Trump. Please connect them all." And so
yes.
I've been praying, and I just interviewed Dr. Dan Erickson last week, and he says, I said, well, give me some hope. What big things are happening? What's good stuff? And he says, well, Governor Noem from South Dakota and I and Dr. Atlas are going to be meeting with the White House and President Trump. And I had goosebumps. My brain almost exploded. And it's so cool that President Trump, I think he's on to the thing. I think he's on to what's been going on. I think he knows with the game.
Yes.
I mean, this is pure speculation. It's not speculation that President Trump is, in fact, meeting with Dr. Scott Atlas. That is not speculation.
Correct.
But it is speculation that he knows what you and I know. But can you kind of encourage listeners out there? I mean, do you believe that President Trump knows what we know, or what do you think's going on in the White House?
Oh, I absolutely do believe that he knows what we know, and that's why initially he was pushing for things like hydroxychloroquine, because, like I said, early in the disease it had shown to be extremely beneficial to people, and that's why he was talking about UV light therapy. I mean, that's not abnormal. There are facilities that use UV light to basically disinfect themselves from viruses and contaminants, and people twisted that around, and said, oh, well, he was talking about injecting bleach and all this stuff, which was just simply not true. But yeah, I believe that he knows what's going on. And here's another bit of good news that happened yesterday. The state of Iowa, the House of Representatives, voted to basically declare the coronavirus no longer an emergency or a pandemic.
Oh, yes.
So,
yes.
Yes.
Come on.
Mm-hmm.
That's what I needed.
So people are starting to wake up and see. The only thing that I am cautious about in myself is that people have been quarantined and masked and, for so long that when flu season comes around, their immune system is just not going to be as healthy as it was this time last year. So they're going to have to be extremely cautious when they come back out into the world, per se, and focus really on boosting your immune system.
My final question here for you is Dr. Scott Jensen from Minnesota, the senator. He's been on Fox News a lot. He's been on our show. He said that this guy was a former pastor before he became a doctor. Okay, he's legit. And he said that he received an email from the Minnesota Department of Health coaching him on how to fill out death certificates related to COVID-19, and that he in his entire medical career has never previously been coached on how to fill out death certificates.
Correct.
How is COVID-19 being treated differently than other viruses by health officials?
Because it's being financially incentivized. I mean, that's just basically what it is. The hospital system and all of these states are being financially incentivized to boost their numbers of coronavirus. And that's just a sad fact. And Dr. Scott Jensen, he gave an amazing talk initially on masks and their efficacy. And he was, talk about cancel culture. He was, attacked by these groups. and some people were even reported into the medical board, and his medical license should be stripped, which has never happened. I've seen several doctors in the world that are basically malpractice every day. They're terrible physicians, and nobody goes out and tries to ruin their life and cancel culture them, which maybe they should, maybe they shouldn't. But then you have people that are just trying to educate the public. They're trying to do their part to better, society, and they just get raked through the coals, and it's very sad. It really is sad, but I appreciate that there's more and more physicians that are willing to step out of the shadow and say, something isn't right here, and we need to stand up against what's happening today.
I really, really, really appreciate what you're doing, what you're sharing. I want to have you on the show again. I really do, because we have about 500,000 listeners that listen every week that love to hear the truth from people like you. And yes. I met with a guy yesterday, and I won't tell the listeners who he is. It's not a I'm not involved in any business dealings with the person. It's somebody from outside of my sphere who was just irate when he discovered that my team based in Tulsa, Oklahoma, doesn't wear masks. And this guy's like, West Coast business guy, and he just sent a big old email. Are you willing to do like a debate? Would you be willing to participate in like a Zoom debate if you knew what the questions were going into it and there wasn't any personal attacks? Are you willing to do that kind of thing?
Is this person a medical person or just a business person in general?
I don't want to slam him on the air. I'm going to say this particular person has a lot of degrees. Some people have a lot of degrees. You have a lot of degrees, but you really don't know. You maybe aren't in the know. And so it didn't come across like on a scale of 1 to 10, not a 11 hostility, but I'd say like a 5, where it's like it could just incensed. Like, I can't believe you guys are so ignorant. And I would love to see if I could set up a little debate. I mean, would you be open to that? Maybe a little debate action.
I might be open to that, but I think maybe Dr. Meehan might have a better shot at debating that. Well, I might be open to that, sure. Okay.
Well, I asked him. He said he's in, and he thinks the world of you. So he thinks the world of you. So I wanted to ask, too. But thank you so much for being on the show. You are awesome.
Absolutely. Thank you. I appreciate it.
Yeah. Well, I tell you what, thank you for being on the show, and I hope you have a great rest of your day. You are just you encouraged me today.
Oh, well, thank you, and you have a wonderful day as well.
And now, without any further ado, 3, 2, 1, boom!